Aloha, everyone, and welcome back to our first campus Zoom meeting for updates for the fall 2021 semester. I hope that your semester started well. We, we, we know that there are quite a few questions, and I did receive some of them electronically. I didn't check within the last 10 minutes, so if you submitted a question within the last 10 minutes, we may need you to submit them through the chat option in the Zoom as we carry through. But as I typically do, I want to provide some general updates and provide some answers to the questions that we've received so far. But before that, I want to reflect a little bit on our convocation. I think that it went really well. I was really pleased with the types of interactions that we had. And of course, the one piece that was a little bit different was our portion, where we had 1 hour to share a great deal of updates, and there wasn't that two-way communication necessarily. But we did get quite a few of those updates out. And so today we'll be able to interact a little bit more and hopefully have some more answers for you. But as has been the case since March of 2020, things do change, on a daily basis, and we are reacting on what's going on and planning for the future at the same time. So it's just a little bit different to be dealing with all of these different circumstances. The first thing that, the first thing that that I would say is different for us in this fall semester is having the mandate for either the vaccine or a COVID negative result to access the campus. And so that is something that we had in conversations throughout the summer, but it didn't really hit until very recently, which made it very difficult operationally to put together for the start. And so there have been a couple of hiccups, and I want to recognize some of those and provide a little bit more feedback and input in those aspects. Some of the questions I will probably address again, even though I may be covering them through my initial remarks. But what came through for our fall semester, we were initially under the assumption that for students, the vaccination was going to be required, and that's when we were expecting the vaccine to be fully approved by the FDA much earlier than it actually happened. And so as a result of that, rather than having the vaccine as a requirement, the option for students to provide a negative test result is available. Up until very recently, we weren't sure on how to operationalize this. It did happen late last week and into the weekend. And we have heard from students as well as employees that have been able to take advantage of the testing options that were made available by the university. And so just to sum those up, the expectations both on the employee and the student side is that you be fully vaccinated, which is defined by having the last dose of the vaccine plus an additional 2 weeks for it to take effect. Anything less than that would not be considered fully vaccinated, which would require you to take a COVID test. The only COVID test that is currently allowed by the university is a PCR test. And all of this is coming together under the LumiSite app, which we have gotten used to in some capacity. So some recent changes within the LumiSite app, you have received some of those communications, are that one, we are in a position to upload our vaccination card. And so thank you all for doing that. I know that many of us have actually uploaded our vaccination card and details. Additionally, for those employees or students that have not gotten the vaccination or are fully vaccinated, you are able to upload the COVID negative test results. LumiSite, in exchange, will validate this information. And when you submit your daily questionnaire check-in response, it will give you that green face that basically says that you're allowed on campus, or it'll put this frowny face with some, I don't know, sneeze, and red that basically says, don't come to campus. And so to operationalize this, we've gotten quite a few questions. Do we ask students to show us their Lumicide? Do we ask students to show us something and validate that they are able to be on campus? Well, there are a couple of ways of doing it. As an instructor for your face-to-face or hybrid class, you can ask the students to show you their Lumicide to access the classroom. Alternatively, I'm letting this out of the bag. They are working on a STAR report where you'll be able to see your roster and an indicator for students that are cleared to be on campus. And so that you don't necessarily have to check in with each student each time. And so you are in a position to do that. We have sent some communications around where we want to protect personal information, especially as it relates to health information. And so as an instructor in a face-to-face class, you are in a position to ask for pertinent information that would allow the student into the class. And so you could ask them for their Lumicide, and if for whatever reason there's a glitch, let me share a couple that you may have already bumped into. The Lumicide app has a glitch on my phone. I get locked out. One of my 4 kids was trying to access my cell phone and locked me out for 60 minutes. And so there may be a couple of reasons why they may not be able to immediately show you the Lumicide. And so we're able to ask for a printout of it, the web version of it, and if necessary, because the upload of the documentation is either delayed or not possible, they can show you their vaccination card or the negative test result. We hope that eventually all of this becomes a little bit less of a burden. From the employee perspective, similar situation. However, what we've been doing, and so that you're aware of it, is that we get a Lumicide report. And the Lumicide report identifies individuals that have checked in and that are cleared to be on campus. And so there's no more follow-up on that list. Then we also have a list of individuals that for one reason or another, get the frowny face and are not allowed on campus. And so we are tracking or connecting with these individuals to see what may have happened. And what we're finding is that one, some people may be tempted to submit the Lumicide questionnaire, even though they're not intending to be on campus, right? So we're following up with them. Additionally, what we're finding is that some of us are very abruptly responding to the questionnaire. It gives a frowny face, and then they go back and they update it because, again, it's just a one question, like a one response questionnaire. But if we do have individuals that for whatever reason aren't feeling well, we are connecting with them and trying to follow up so that they don't come to campus. And so we do have these mechanics in place, not foolproof, right? But we are following up in that capacity. And then there are instances where access into some locations, we know that students have to show their Lumicide, and that's fair game. Again, it's our access point. And so you have probably received the UH announcements too, that some of the Lumicide materials for our apps on our phones are not live yet. And so as an example, and I tried to do this in preparation for the meeting, I printed this from the website for me. It's that big green face saying that I'm allowed on campus. And then if you look down here, it tells you whether you've been tested or vaccinated, and it has the date on it. That, to my knowledge, and I may be delayed on this a little bit, our app is not showing that quite yet. But it will, I think as of today, because the Apple Store and the Google stores have to update the app. And so those options will be then readily available. Lumicide is going to track the validity of the negative test result. And so the requirement both on the employee and the student side is that there is a COVID negative result within a 7-day period. And so weekly, employees and students will need to find the testing site to get that negative result. The hope is that the contractor clinical will be able to automatically upload those results, but in the interim, we can upload ourselves the results, get them validated in LumiSite, and have that available for 7 days. The hope is that LumiSite is going to have a tickler where it expires that 7th day, right? So that you get a newer test uploaded and validated by LumiSite. And so we're just asking, for a little bit of patience with some of the mechanics here, because we're testing them and moving forward. Minimally, I will say that, I participated a little bit in the welcome committee, welcoming students. Most of our students are up to par, and with just a couple of nudges here and there, they get up with their LumiSite and their materials. So I personally feel that we've done quite well. I've not heard of major nightmares or hiccups, but it's possible that they will happen. So just for this week, a little bit of flexibility and malleability on what we can do. I wanted to comment too, because you may have students asking you questions. On our website, when you go into the COVID page for us, we have a direct link to the clinicals portal, where a student or employee is going to be able to schedule an appointment for that COVID test. I did want to indicate that even though you're able to make that appointment online, you're still required to fill out a paper form and take it with you with an ID to get the actual test. The advantage of going through clinicals is that at this point, the cost of the test is being managed internally. So you turn in that form and your appointment with your ID, and you're set. Whereas if you were to go elsewhere, you may have to pay out of pocket, and that goes for students as well. And we know, that clinical's gonna push through the PCR result. I see a comment. Oops, I don't know what I did.
Question is, they weren't interested in looking at that form at the airport.
Okay. Okay. Well, that's good. I don't know that that will be the case in every site. But if they're not requiring it, that's even better, because those of us that may forget, we'd still get the test. And so we'll continue to push forward. We are hopeful that on top of being able to go to one of the clinical sites, that we could periodically offer an on-site clinic where employees and students may be tested as well. What's the question? Hold on a second. I'm trying to see where my chat option is. Oh, here we go. Whoops. Okay. I got sidetracked a little bit. Okay, so let me go over some of the questions that were submitted and try to provide some responses. I'm teaching a face-to-face class. Say an unvaccinated student shows me a negative COVID test result. Within what time frame must have the test been taken? A 7-day period. And so if it's within the last 7 days, it's valid to that date. And so that's the time frame. Recognizing that the test needs to be a PCR test and not the antigen test. More will materialize because we want to have more options available, but as of right now, that's a position that we are in. I'm going to jump around because I'm doing the questions in the order that I received them, so they may not all be within the same thought. Will faculty be required to teach on campus in the spring of 2022? And so, like we have been navigating, semester to semester, We would hope that this pandemic were a linear relationship, but what we're seeing is major curves in this in the pandemic. And so as things get better, we would hope to have more face-to-face classes. If things continue to worsen or don't improve, we may be seeing more online classes. Quite frankly, the requirement to have face-to-face classes is going to follow enrollment trends. We are not blind to the fact that some students, maybe because of hesitation as a result of the pandemic or preference, are choosing online classes over face-to-face classes. And conversely, we know that there are students that really want those face-to-face classes. And so we want to be able to offer what is necessary for our students to progress, but not necessarily having a major directive per se. And so more information will be coming out, especially through Keala's side of the house, as more guidance come through, and working with your chairs and your coordinators to see what the students' needs are. There are other follow-up questions, and I'm sure I'll have additional comments about this. Can faculty choose to continue teaching fully online if they have taught in this modality in the past? And so working with your division chairs and coordinators, we just want to make sure we have that robust schedule that allows for our students to complete in the modality that the students need. As you're probably aware, there are some disciplines that haven't had much online presence because they're very practical and hands-on. And then there are others that have been online where our students may not be doing quite as well, or where the preference is shifting. So do work with your chairs and coordinators. You can opt with your division chair and coordinator for your preferred, but we still want to be able to recognize where our students need us and schedule classes that way. You're probably familiar with what happened a couple of semesters ago, where we were trying to do a much stronger rollout of the face-to-face classes, and then we came back to online. And so it's a little bit early, but more information will come out, and we'll keep you abreast as we continue navigating this. What exceptions or options will there be to teach online rather than on campus? And so at a time where we're going with enrollment trends as well as our student needs, we're hoping that whatever those are, we can gratify and staff and schedule those classes. There will be exceptions that are managed as have always been managed through HR. If there is a medical reason or some other reason, these have to be managed through that process. And so if the pandemic is still in effect and we're trying to reduce the presence on campus, that too could come into consideration. But as you probably have heard, as of, I want to say this morning, or maybe yesterday, the FDA approved the Pfizer vaccine. And so as a result, coming spring 2022, the requirement for that vaccination is going to come into play. And so we should be in a slightly better place, even though we're seeing some strange things happening with the case numbers statewide and globally. Okay, where is the university in terms of reorganization? Is this a non-issue now? So some of the reorganization matters that came about are still progressing. They may have slowed down a little bit because we've been trying to come up with all of the, how do we deal with the Lumicide and the testing and the whatnot to start the fall semester, but some of these conversations will ramp up. Some of you may already be in some of these conversations because we're continuing to move forward, recognizing that finances are not necessarily the largest impetus, but more of a student outcome component and a sustainability matter. Again, it will be more catered more to specific areas, as you're probably aware. There are more narratives happening with, say, financial aid in some of their aspects, as well as A&R in some of their aspects. And there are other areas too, where there are some conversations happening, but they're at different levels. I think that Where we are is that we could take a little bit more time to do more intentional change rather than abrupt change as a result of the pandemic. And so again, it's a non-issue. It's not a non-issue, but it's taken a slightly different lane. During the July Board of Regents meeting, President Lassner did share the vision for the university, got quite a bit of feedback, and we are still in line for a November Board of Meeting update from the president on more operationally what we're going to be doing for the entire university. Okay. Okay, this question was a little bit long. I'm going to try to, so a more detailed plan. So this is a reflection of how we have things detailed out on our website. Again, we have the interim COVID guidelines that are UH-wide, and then we have components that are Leeward specific that address more of campus matters. And so, you know, what do we do in the case of unvaccinated students or employees that are required to show a negative test result? Well, the biggest indicator is really that the app itself is telling the employer or the student to stay home if they haven't followed through with what's necessary. The next level of it is that we are from the admin offices pulling a report for those individuals that have been given the no to not come to campus and following up with them to see what they may be missing or providing resources so that we could get them up to par. Then the follow-up question is, to whom do they show this? Well, as a faculty member in a face-to-face class, hybrid class, or even in an enclosed space like an office, if the students coming in, we can query them for the Lumicide Clear, and that should allow them in. If, again, for whatever reason, and we hope that these wrinkles get ironed out over time, if they can't demonstrate this through Lumicide because of some quirk, they can show you the negative test result or the vaccine. We just ask that we don't keep copies of this individually. Again, just to protect their information. And so again, maybe the first day of class or even the first week may be a little bit of a hiccup. If we do experience that it is delaying the start of the class or interrupting too much, then we may need to rethink the process. Finally, as I mentioned before, there will be a star report where you could see your roster and when students clear. And so these are all mechanics on how we can address this requirement. The same goes for employees. I don't think that it is necessary to validate that everyone has a Lumicide, but everyone should be completing the Lumicide, and we are picking up on those instances where we need to follow up. And we're trying to follow up and hope that individuals that have some symptom don't come to campus to let us know. So please, if you have symptoms and Lumicide tells you to stay home, please stay home. We'll reach out to you, connect with your supervisor, let them know, and we'll connect all of the other resources. But that's in essence what we need to do in the interim. As you're aware, hopefully aware, and if not, I'm letting you know now, some of the messaging that came in late last week, including the COVID-19 vaccination and testing policy. This is on the UH website. It's linked in our website as well. And it basically reads what these expectations are both on the student and employee side and consequence, right? And so for the students, we have code of conduct. If a student for whatever reason and I'm just going off script here to answer some of these questions, but if a student comes to your class and does not want to show you Lumicide or refuses to upload something or refuses to test, you could simply ask them to please leave the class, leave the campus. If they refuse to do so, then we would need to contact security. The same thing will be happening as it relates to employees. If for whatever reason we track that an employee is refusing to upload their materials, the testing and vaccine policy have that mandate and make note to discipline. And so we will work out more of those details if we get to that point. We're hopeful that that's not the case. but there is disciplinary action if there's some refusal to push forward. I'm reading into the text whenever possible. And yes, as it relates to masks, we have to wear masks when indoors and in classrooms, and that goes for the students. If the students refuse to wear their masks, we could simply ask them to leave. If they refuse to do so, then we call security. I'm hoping that that's not really at all a situation. I think that we're bombarding students and employees with a lot of this information. And so again, from a process standpoint, feel free to communicate with your students electronically ahead of class and let them know the expectations, right? And if they are refusing, they should leave the classroom and campus. And if they refuse to do so, then security would be the next recourse. And I'm keeping tabs on this. If there are instances where this is happening, I want to know so that we could, be more supportive to the campus community in that case. Okay, so another question is, and this I'm gonna again go off script a little bit to add to it. So what is the protocol if a student is in a face-to-face course and gets coronavirus? Well, on our website, the very top banner, there is our COVID page, and on the left-hand side, there's a link to it too. There's a big button, it looks like a telephone app, where you say, report a case. This is where a student or employee or someone could report themselves or indicate, for instance, when a student emails you and tells you about their case, you could then communicate through that LeeCOVID link as well. We will then follow up with the student or the employee to gather more information and provide instructions and what we could do next. That's generally speaking the process. From a student perspective, ask them to go through that reporting link. It's a Koali build. You enter your information and boom, we are able to connect with the individual. If for whatever reason, they share that information with you and you're not certain if they have the right instructions or whatnot, you could connect with us as well through the LeeCOVID email. And we can connect with the student or employee that way as well. And so hopefully that's not happening while they're on campus. If you have students coming face-to-face and you get questions about the students or you want to provide guidance, we don't want the student to come to campus if they're waiting for their COVID results, especially if they have some kind of symptom. Have them wait home. They don't get a clear on Lumicide unless they're intended to do so. So we don't want to bring them on board unless we're certain that they should be here. Okay, we got a question about the use of the testing center to maintain the integrity of online classes. And so as you can imagine, I was ready to come back. I was ready to have a party during convocation, but it rained down on us. We can't really do all of these things. And so we're still more or less in a restricted capacity. Right now, the testing center is on very limited capacity. And so the direction is work with your division and your coordinators and the faculty within the same discipline to see if there are additional types of assessments that will get us there. We do hope over time to be able to bring back some more of these services, but right now we're still quite limited because the social distancing is still in effect. And we have been able to, over the last year or so, build out different assessment types. And so we may be able to connect in that way. I'm gonna nudge for Leanne's contact information if anyone wants to look at other resources. But that's kind of where we are as it relates to the testing center. Okay, and the last question that I received, and I hope I didn't skip any because I didn't number them. A student mentioned that they couldn't upload the negative COVID result into Lumicide. That's very true. I've been trying to do it so that I know how to answer questions when I'm asked. That option should come live pretty soon. It is live on the web-based version of Lumicide. And so a student could upload it that way. The easier way is once clinical is able to push it to us. The next easier way is once the app gets updated. And so, we should be able to take a picture of it and upload it. But what's critical is that we allow Lumicide to do the validation. But if a student is sharing that that's a circumstance that they're falling into, quite frankly, I was having a conversation earlier today with the welcome committee, and I was saying that when my kids put their hands on my phone or my wife's phone, sometimes they try our passwords so many times that they lock us out for a couple of minutes. Some of these things can be real. The other thing is, I forgot my Apple ID password, so I can't even go into the store to download the app. Some of these circumstances do exist. So let's be a little bit flexible there. If they can demonstrate the COVID negative test, and all we need to look at is that it happened within the last 7 days, we should be in good shape there. Over time, these instances should be reduced. If there are, that's the extent of the questions that I had here, and I don't have in front of me the form where everyone was submitting questions. So if you have any fresh questions that you've submitted within the last couple of minutes or while I've been having this presentation, please feel free to slip them into the chat, even if it's a private chat. I'm happy to try to answer those questions. Overall, I think that the semester has started well. We're still a little bit uncertain and uneasy. One of the things that I wanted to reflect on, which we are getting tied up in as a, as a community, not just here at Leeward, but nationally too, is that the test that is most reliable for the sake of all of this is the PCR test. And we also know that the PCR test is gonna pick up whether you were positive within a much, much longer and extended period of time. Right now, the number that I think it's floating around is 90 days that we may test positive. And so right now, Lumicide and the university system are trying to figure out how we can address that because we may be showing positive even though we're not actively positive. And so we may need to find another way of communicating that circumstance. So if there is an outbreak on campus, for instance, if for whatever reason, and so I'll define outbreak. So as you're probably aware, we've had, I want to say 4 instances since the start of the pandemic where we've had a COVID positive case on campus. Depending on the interactions of the individual, we may need to shut down some spaces or ask close contacts to quarantine and test before coming back. An outbreak would imply more of a spread situation, right? So if there was some sort of class where all of the students were COVID positive because they were here, there would be a slightly different narrative, but at the university level, I haven't heard that to be the case. The extent to which we've seen is a little bit of close contacts. And so we'll continue to do that contact tracing, working with the Department of Health for guidance. There are protocols for cleaning spaces and keeping them closed for periods of time. But that being the case, I'm not hoping for any spread here on campus. And we are trying our very best to avoid any of these instances for not so, I'll say it, for peace of mind to some extent. The volume of students that we have on campus this semester are a reflection of what we had last semester. So we don't have major groupings of students on campus or a surge of additional students that are happening. And we're still being very conservative on what we are allowing to happen on campus. So yes, so for our non-credit students, we did identify as an issue that in order for you to go through the clinicals portal to schedule for the test, you need to have a UHID. And so we're working on ways in which we could address it for the non-credit students that don't have that UHID. I don't have an update as of right now, but you better believe that as soon as I have it, it will go to OSUD so that you all can plan accordingly as it relates to extending the testing option for our non-credit students. Any other questions? Okay, if anyone's thinking of them, again, as I was reflecting, I think that we have managed quite well. This is that transition week where we're testing all of these things out. We do have instances where, you know, a student may be turned away and so on, and we're hoping that those diminish over time. I do want to celebrate a couple of things, and I hope that you all celebrate them with me. As of yesterday, our enrollment numbers were up from last semester, from last year. And again, that's a major contribution to what everyone has been doing. Quite frankly, a lot of offices have been cold calling students just to make sure that we could do the best that we can to get them going. And so we're in a good place enrollment wise. We're in a good place in many other capacities. And so that's something to celebrate. We just need to continue, you know, trucking along for what this pandemic has for us. And the last thing, and I don't know if I mentioned this during convocation, but I really did want to mention it, is that our campus is just beautiful. And I reflect on this because I walk the campus quite often. And in the recent months, and I think it's because, you know, we haven't had as many students and activities on campus, our grounds are looking quite nice. And so take some time to walk around if you are on campus. We do have a beautiful campus, and I want to recognize the folks that have been really working hard on that. Our O&M folks that have been really diligent on this, our security folks that have been, you know, tightening up things for us. This is just something that I reflect on often. I nudge Lorelei all the time. But quite often when we're in these larger meetings, it doesn't come out as organically. The campus is looking really nice. And when some additional spaces that are under construction, you know, unveil, we will be in even better shape. I was having a conversation with Lorelei in saying that I wanted the garbage container, the dumpster that was in front of the staircase, moved away from there because it was on our sidewalk. And now we have a little bit more scaffolding around campus, but that's all good. Scaffolding's not pretty, but it's gonna get us there. And so I just want to thank everyone for all of that work. Betty, thank you for you know, recognizing the beautification committee. Many folks were out here trying to replace some signage. We are going through some major projects to get our campus up and going, and what a great opportunity. I want to give kudos to Tad and everyone that supports him. We have tried to change quite a bit of signage, and if you heard through our convocation, we're trying to make things a little bit clearer for our students so that they're not just wandering around. And one of those big contributions, and I want to thank everyone that, you know, worked on that, Kay, Leanne, Tad. I mean, it was a lot of heavy lifting to try to get us a contractor to help us with our new website. And so while I have nothing to show right now, it is something that will be wonderful for us, and it's soon to come. So just keep tight. Don't send emails to Tad yet, but we'll get there because we want to update everything and have a really amazing website. Nicole, I'm not really sure of that comment, but I'm confident that Lorelei is taking notes right now, so we'll be able to address that. Yeah, again, I just wanted to recognize all of the improvements that have been happening, and again, it's your input and it's your doing. So thank you all. Everyone has been doing an amazing job, and I'm just very happy. that we're in this position. Again, I'm open to questions, but if not, your time is really important. And so I don't want to delete that much longer unless we have questions. Thank you, everyone. Wishing you the absolute best. Keep communication open and tell the students and coworkers if they're not feeling well to stay home. Thanks, everyone. Have a great semester and we'll continue communicating.